Hi, my name is Joel Murray, and this is the Chapter 15.1 case study. So, starting off with Susan's calcium, vitamin D, and protein intake, her main sources of calcium in her diet are milk, cheese, and chicken. And as for her vitamin D, this is coming from the tuna and salmon that she eats. Her calcium and protein intake are pretty strong, very easy to implement in her daily diet. As for the tuna and salmon, this specific area could use some work if we're excluding her daily supplements that she takes. And moving on to Susan's weight loss and physical activity, I believe that implementing weight training could possibly help with her bone health. The reason for her decline in bone health is possibly due to her aging. Older women tend to start losing weight from the loss of skeletal muscle around her age. And continuing with this, when looking at her lab values regarding her bone status, it's very possible that Susan suffers from rheumatoid arthritis at her age. There is a correlation with the women over the age of 60 and having rheumatoid arthritis. And touching back on the weight training, I believe that having these exercises could help relieve Susan's stress and possibly relieve any like discomfort or pain that she feels with dealing with this specific disease. And touching on her supplement recommendations, with her supplements, along with her current diet, I believe she is having a sufficient amount of vitamin D. Most people in the United States actually do not consume the recommended amount of vitamin D. The minimum uh, I use of vitamin D are 800 for people over 50, and the maximum amount would be 4,000. So, with that being said, I believe with Susan's current diet, she should continue taking her vitamin D supplement, and I believe that should be sufficient in regards to her current health status and her age.